As COVID-19 ramps up in South Africa, hospitals are seeing more patients suspected of having the virus, but the pandemic is also causing an increase in the number of mental health-related problems due to the pandemic.
While clinics and hospitals are open, very few of them still pay attention to current mental health care users during this time. And also there is no screening for mental health during COVID-19 screening and testing.
Experts warn the nation's healthcare system is underfunded.
Now we are in the pandemic and you're finding yourself sort of on the back foot with an already fragile system and not knowing how to go about fixing it. But knowing that it is a poorly resourced, poorly distributed system.
Critics say only few can get the mental health care they need due to the lack of resources.
In South Africa, only 5% of the national health budget goes towards mental health services.
Experts say the global pandemic has left many unsure about what lies ahead.
There's all this anxiety around unknown factors that's out of our control. People will often catastrophize and imagine the worst possible outcome.
Wendy Jones, an anxiety sufferer, says she needs mental health assistance.
I personally feel more anxious. I get really worried. And who do I go to? Am I on the right medication? Should my medication be increased? I don't know these things. I need somebody to tell me. Your trust in the medical system as it is should be complete. It should be absolute, but it isn't.
South Africa has been through similar health crises before, and studies show the impact is lasting.
There will be some long-lasting effects on the psyche and the mental health state of the population, based on what has happened before. We've had SARS, we've had MERS, we've had Ebolas, and all of these have required some sort of lockdown or some sort of quarantine to take place. And studies emerging from that have found out that this has had a detrimental impact on people's mental health state.
Experts say they worry this time the mental health care system will not be able to meet the demand in months to come. Franco Puglisi for VOA News, Johannesburg, South Africa.